For our new drug product, we did Wakix or Pitolisant. This drug has been approved to treat narcolepsy, excessive daytime sleepiness, and cataplexy. The exact mechanism of action is unknown, but they have found that it works as both an antagonist and an inverse agonist for the H3 receptor. What they think is happening is that Wakix is blocking histamine from binding to H3 receptor blockers and increasing the synthesis and release of histamine, and having this increased amount of histamine out and around lets more of it bind to H1 receptors, which allows for increased communication to the areas of the brain that are in charge of sleep and wakefulness. The two biggest, most common adverse effects that have been found with Wakix are insomnia and anxiety. And then the most concerning ones that need to be reported to a doctor right away, or even in some cases need to go to the ER right away, are hallucinations, difficulty breathing, fainting, and irregular heart rhythm. Some of the other side effects that they have seen in the studies for Wakix are headache, upper respiratory tract infections, increased heart rate, irritability, abdominal pain, cataplexy, decreased appetite, and dry mouth. Some nursing tips in terms of administering this drug, it's pretty easy. It's just 1 pill a day in the morning. If a dose is missed or anything, they don't do a double dose. They just continue to take it as is the next morning. There's not any big assessments that need to happen before or after this is started at this point in time. But some important things to educate the patient on are Wakix can decrease the effect of hormonal birth control. So if they are needing birth control, they'll need to use other methods. The use of Wakix during pregnancy is still being looked at. There's actually is a study happening with it right now. So the website says if someone who is pregnant is going to start it, to let this study know so that they can watch what happens. As I said, there's no assessments. There's also no baseline ECG or labs that are needed prior to starting Wakix. However, recently there have been some reports of prolonged QT interval with Wakix. So in the future that may change. This is not recommended to use if the patient has severe liver or kidney disease. And then some other medications that we'd want to notice in a med reconciliation if a patient is taking Wakix are amiodarone, cyclosporin, bupropion, rifampin, moxifloxacin, phenytoin, and diphenhydramine.
For our memory aid, we chose to do a little play on words. So for the brand name Wakix, you can ask yourself if you have trouble with excessive daytime sleepiness or cataplexy due to narcolepsy. So you should try Wakix to wake up your day with a kick. And for Pitolisant, our generic name, you want to stop your midday pit stop so your body will listen to your new sleep habits. Our NCLEX question asks what statement by the patient about their new prescription Pitolisant indicates the need for further teaching. 1, I should continue taking Wakix even if I don't see results within the first few weeks. 2, I should use another form of birth control because it may decrease the effectiveness of more hormone pills. 3, I can take Benadryl for my allergies this summer because it doesn't contain histamine. Or 4, I should not take this medication because of my history with liver disease. The answer is number 3. This patient should not be taking diphenhydramine because it's an antihistamine. So this can result in reduced effectiveness of the Pitolisant due to Wakix's effects of increasing histamine in the brain. So all of the other answers show appropriate patient actions because Wakix can take up to 8 weeks, they've found, to start showing results. And Wakix can reduce the effectiveness of the hormonal birth control pills, and it should not be used in severe liver or kidney disease. So the application level states that the student must apply the knowledge about Pitolisant's effects on histamine as well as diphenhydramine's effects of histamine.
And these are our references.